Hello, everyone. My name is Kellie Bryant, and I am a women's health nurse practitioner. And in my current role, I'm the Assistant Dean of Clinical Affairs and Simulation and Associate Professor at Columbia University School of Nursing. Most importantly, I'm a proud member of Alpha Kappa Alpha Sorority Incorporated. So, as we are all aware, October is Breast Cancer Awareness Month. Breast cancer is the most commonly diagnosed cancer among American women and the second leading cause of cancer deaths among women after lung cancer. Many of us know someone who's had breast cancer, or unfortunately, some of us may have lost a loved one due to the disease. So as part of Breast Cancer Awareness Month, I wanted to share some important information about the disease. So, statistics. About 1 in 8 U.S. women will develop invasive breast cancer over the course of her lifetime. The good news is that breast cancer deaths are going down each year, and that's due to advances in treatment and also better screening. Signs and symptoms of breast cancer. These are some of the signs and symptoms of breast cancer that have been established according to the American Cancer Society. Any swelling of all or part of the breast, skin irritation or dimpling, breast pain, nipple or nipple turn inward that wasn't inward before, redness, scaliness, or thickening of the nipple or breast skin, nipple discharge, and that could be any color. It could be black, it could be red, other than what you're expected if you're breastfeeding or if it's breast milk. And of course, the most obvious sign is a lump in the breast area, and that is not only the breast, but if you have a lump underneath your arm. These are all signs and symptoms that you would want to get evaluated by your healthcare provider as soon as possible. Most of these symptoms could be benign, but just to be on the safe side, you want to get them fully evaluated. Risk factors. What are the risk factors for breast cancer? The most obvious risk factor is just being a female. I say that because men also can get breast cancer. Age. As we age, our risk of breast cancer also increases. And a family history. Even though most cases, only 5 to 10% of breast cancer cases are thought to be hereditary, there's still a part where family history can play a role. So women with close relatives who have been diagnosed with breast cancer do have a higher risk of developing the disease. For example, if you had one of your first degree relatives, so that's your sister, your mother, your daughter, that was diagnosed with breast cancer, your risk is doubled. So you want to be aware of your family history of breast cancer. Also, race and ethnicity. White women are slightly more likely to develop breast cancer. However, black women are more likely to die from breast cancer. And the reason being is black women are more likely to be diagnosed with a more advanced stage of breast cancer compared to white women. And that's due to many factors: healthcare disparities, such as socioeconomic inequities, lack of access to quality health facilities, racism by healthcare providers, mistrust, fear, medical system barriers, and that undoubtedly contributes to about 40% higher breast cancer mortality rate seen in African American women. And a lot of that causes delays in diagnosis, and when we delay diagnosis, we tend to be found with far more advanced stages of the breast cancer, which is harder to treat. Other risk factors: being overweight, drinking alcohol. Research consistently shows that drinking alcoholic beverages, whether it's beer, wine, or liquor, increases a woman's chance of breast cancer. Having dense breasts. Sometimes when you go for your mammogram, you'll get a report that says you have dense breasts. Dense breasts makes it harder to diagnose breast cancer, so you just want to be aware if you have dense breasts, that puts you at a slight increased risk. Having a longer time of having your period. So whether you started your periods at an early age or you're getting your periods beyond the age of 55 also puts you at risk for breast cancer. Lack of exercise has been found to be a risk factor, and smoking, including secondhand smoking. These are all risk factors for breast cancer. Some of these we can change, and some of them, unfortunately, we cannot change, like our gender. Let's talk a little bit about prevention. Prevention is much harder. There's no steadfast, if you do this, you'll significantly reduce your risk of breast cancer, but research has shown that there are a few things that we can do. One of them is just maintaining a healthy weight, and we do this through diet and exercise. Being physically active, 150 to 300 minutes of moderate intensity exercises a week, Or if you're really vigorous with your exercise, 75 minutes to 150 has been shown the ideal amount of exercise that can reduce your risk of breast cancer. And again, as we talked about before, if the risk factor is alcohol, then one of the ways that we can try to prevent breast cancer is by limiting or avoiding alcohol altogether. So, and this is best for women who drink, that they should not have no more than one alcoholic drink a day. So let's talk about a little bit about screening. What can we do to find out if we have breast cancer? So the first thing we can do for ourselves is performing monthly self-breast exams. And usually you want to do this after your period, because before your period, sometimes we have lumps, we have cysts. And 40% of diagnosed breast cancers are detected by women who feel a lump. So it's important that we establish a routine of examining our breasts. And there's multiple ways you can do that. You can do that in the shower. You want to use the pads of your fingers, and there's different techniques for doing a breast exam. And you want to rotate through your breast to see if you feel for any lumps or masses. And you want to check both of them, and don't forget to check underneath your armpit in addition. You want to look at your breast. So you want to make sure you're looking at your breast in the mirror for any of those dimpling or changes in the skin, with your hands up, with your hands down, and with your hands pressed into your hip. If you see any abnormal lumps or anything, again, you want to report it to your healthcare provider right away. Another way you can check your breast is when you're laying down. You can lay down and put a pillow underneath the side that you're checking. And again, using the pads of your finger, feel around your breast in either circular motion, or you can go up and down to see if you feel for any abnormalities. The best way that we can screen for breast cancer is a mammogram. I had my mammogram, matter of fact, today as I'm recording this film. I'm coming back from my mammogram. So a mammogram is an x-ray of the breast. It is the best way for detecting breast cancer early. And you want to have regular mammograms. And there's a lot of different recommendations for when you should start or how often you should go. So I'm just going to give you general recommendations. The American Cancer Society recommends women when you're 40 to 44, you have this option. You're going to make that decision. You can make it with your healthcare provider, whether you should start your yearly mammograms at that age. However, between the ages of 45 to 54, most bodies recommend that you have a mammogram every year. And then once you reach the age of 55, again, that's a discussion you have with your healthcare provider, and based on your personal decision whether you have a mammogram every year or every 2 years. If you have a family history of breast cancer, however, you should have an annual mammogram starting no later than 10 years before the age of the earliest diagnosis in your family. So if you, for example, your mother was diagnosed with breast cancer at 38, you want to have your first mammogram at 28. So the first recommendations for people with just regular risk factors. If you have a strong family history, a first-degree relative, then again, you want to get that mammogram no later than 10 years before the age of the earliest diagnosis in the family. I know this all can be confusing, but again, you can talk to your healthcare provider about what the recommendations should be. Also, clinical breast exam is important, and that is a breast exam that is done by a doctor or nurse and someone that has clinical experience. That should be done at your annual GYN or your annual physical exams to see if they feel for any lumps. So that is what I have for, we talked a little bit about the statistics, we talked about signs and symptoms, we talked about risk factors and prevention. So I just want to just say on an ending note that breast cancer, if caught early, is highly curable. There's a lot of money going into breast cancer research and development of new treatments, even for advanced stages of breast cancer. And remember, the American Cancer Society, they report that 99% of people who receive treatment for breast cancer in the earliest stages live for 5 years or longer. So for more information about breast cancer, you can visit breastcancer.org or cancer.gov for more information. All right. Thank you for listening, and take care.